Okay.
Okay, so tonight, welcome everyone. This is the CSRT California Student Committee meeting. Tonight we are really excited to present Kevin R. Clark as our guest speaker. I'm just going to introduce him a little bit. Dr. Kevin R. Clark is an associate professor and associate director with the School of Health Professions at the University of Texas, MD Anderson Cancer Center in Houston. And he served as the chair and the delegate for the ASRT educational chapter. And he is a member also of the Radiologic Technology Editorial Review Board and the ASRT Foundation Research and Grants Advisory Panel. He's an active member of the Texas and Louisiana ASRT affiliate societies and the ACERT and the Texas Society for Advancement of Health Professions. In 2021, Dr. Clark was elevated to fellow for AEIRS, and in 2022, he was elevated to fellow for the ASRT. He serves as director at large on the AEIRS board of directors, and in his spare time, he says he enjoys playing the piano, baking home butter, and watching the Houston Astros. So without further ado, I would like to introduce Kevin. Thank you. You can take it away, Kevin.
Thank you, Michelle. I didn't know if I could get away with wearing a Houston Astros shirt tonight, but I know there's a little bit of bad blood there. Let me just share my screen and we will get started. All right. So I appreciate this opportunity to speak. Ever since I met Michelle at ASRT, I've been looking forward to this. So thank you so much for this opportunity. Tonight, we're going to look at a pretty important subject, but it is sensitive. It's a difficult one to talk about. We're going to look at the crime of human trafficking. And just to give you a little bit of background information, here in the state of Texas, when we renew our state license through the Texas Medical Board, we have to document that we have completed at least 1 hour of prevention education in human trafficking. And so the ASRT wanted to offer a course specific for RTs. And so thankfully they reached out to me. And so I put this presentation together. We have about 28,000 RTs in the state of Texas. They just wanted to make a little bit of money in terms of CE, but I certainly appreciate the opportunity because I've been able to give this talk quite a bit. Several affiliate societies through the ASRT, and so just got back from New York a few days ago. But anyway, just as an FYI, I am not an expert on human trafficking. And if I'm honest with you, when the ASRT first reached out to me, I was like, yeah, I'll do this. Because in my mind, I kind of thought I knew what human trafficking was. And then when I dug into the literature, I quickly realized I didn't. And so the Texas Health and Human Services Commission actually reviews these courses and they approve. They say, yes, this course meets the requirements, and they have a list of objectives that we have to cover. So I just tell you that because some of the information I share with you, it may seem a little far-fetched. It may seem like I'm making this up, but trust me, it has gone through a rigorous review process. Doctors, nurses, social workers, and even law enforcement. Just a little bit about me so that you know I'm just not somebody off the street. I'm proud. I'm a proud owner of that yellow and blue ASRT fellow ribbon there. I was elevated to ASRT fellow in June, and you know, I had set a goal for myself when I started teaching college at the age of 35 that in 10 years I was going to earn dual fellowships for ASRT and AERS. And so I'm 44. So I made it in 9 years. I met my goal. And so now I can just relax, enjoy life, and get ready for retirement there. So I don't have any conflicts of interest to disclose. I am not making any money off of this talk, but what I do need to share is that some of the content is a little sensitive. Because of the nature of the crime of human trafficking, some information that I share may be upsetting to you. And then another important point to make is that research on human trafficking, it is limited. A lot of what we have out there comes from survey research where we have actually surveyed survivors, those individuals who've managed to get out of the lifestyle. And of course, with survey research, lots of limitations. You know, we hope that they're answering the questions accurately, honestly. We hope that we're asking the right questions on the survey, that they're understanding what we're asking. So lots of limitations when it comes to the literature and research, but there is consensus that the crime is underestimated, it's underreported globally, but just as much here in the United States as well. So for these next few minutes, basically I want to just share with you the two types of human trafficking, the two forms that are recognized here in the United States. There's different types of human trafficking, but legally we only recognize two common forms. We're going to look at the concepts of force, fraud, and coercion and how they play a role in determining whether the crime constitutes as trafficking. As healthcare providers or future healthcare providers, we're going to talk about those individuals who may be susceptible to trafficking and what are the red flags, what are the warning signs, things that you can look for when they present for care. We'll briefly talk about the health impacts, and most of the literature out there tells us that we need to use a trauma-informed approach when we are caring for and interacting with these victims. And as Michelle mentioned, next month I'm going to do a talk just on trauma-informed care. But we'll just briefly kind of introduce it tonight. And then throughout the talk, we will discredit or debunk some common myths that you may have heard of human trafficking. And since we are a small, intimate group, feel free to stop me at any point with questions or if I'm not clearly explaining something. So let's say you're a sonographer and it's a busy, busy day in the department and you got outpatient after outpatient and you received a requisition from the ER for a transvaginal ultrasound. And the requisition tells you that the patient is experiencing pelvic pain, some abnormal bleeding, and she has a low-grade fever. So in between your outpatients, you jet down to the ER to get this exam done. When you walk into the room, you notice a young lady sitting quietly on the stretcher, and a man sitting in the chair next to the stretcher stands up, to meet you. You introduce yourself, you ask the young lady to state her name and her date of birth, and the man quickly responds, and he tells you her name is Maria, her date of birth is May 1st, 2001. You politely tell the man that you need the young lady to respond to your questions. And as you reach for her armband, she kind of flinches from your touch, but she never makes eye contact. She never speaks. But the man informs you that he is her boyfriend and she doesn't speak a lot of English. So he'll need to accompany her during the exam to translate. Since she hasn't spoken, hasn't made any eye contact, you agree. Now in the department, with the boyfriend translating, you explain the procedure and you tell them that before you can start the exam, she needs to empty her bladder. And as they walk away, the boyfriend and the patient to go to the restroom, you notice some bruises on her arms and her thighs, and they're kind of all in various stages of healing. When they return, the boyfriend is translating, and because you're telling the young lady that she needs to position herself at the foot of the bed, her feet in the stirrups. You're getting ready to start, and you notice a tattoo on her inner thigh. The skin around the tattoo is red and it's dry. The skin is irritated, but the tattoo reads 713. You also notice some cotton debris at the vaginal opening. During the exam, the young lady is extremely tense. She's anxious. And when you finish, you remove the transducer and you notice blood, abnormal vaginal discharge, and more cotton debris on the probe cover. You send your images and your preliminary findings to the radiologist. You return the patient and her boyfriend back to the ER, and then you proceed with your next outpatient. I want you to keep this scenario in mind as we go through this talk, and we will revisit it again at the end. So you might be asking, why is human trafficking prevention education important for me as a healthcare provider? Hopefully, this statistic gets your attention. Up to 80% of victims said they saw a healthcare provider while they were actively being trafficked, but they were never identified. That cycle of exploitation that these victims experience, that cycle can never be broken if we as providers, we can't recognize potential victims. And in this particular study from 2019, it's from a nursing journal, but the survivors that they surveyed said that they saw providers at primary care appointments. They saw them in the ER. They saw them for OBGYN visits, and even at the dentist. They had dental appointments. And that is why prevention education on human trafficking is important. And remember, up to 80%, it's probably underestimated. So you're going to see the Polaris Project cited pretty heavily in this presentation. And the Polaris Project is the nonprofit organization that operates and maintains the National Human Trafficking Hotline. And this is a map from 2020. And this map represents the number of calls made to the hotline, as well as the number of investigations that were initiated because of those calls. And red obviously signifies a higher number of calls, a higher number of investigations. What happened in 2020? We all know what happened in 2020, a pandemic, and everything from crime to commerce saw dramatic shifts. Interestingly, numbers related to human trafficking, when we compare it to 2018, 2019, numbers remained fairly consistent. So it's almost as if, human trafficking is pandemic proof. My takeaway when I look at this map is there really isn't a state where there wasn't some type of activity that was reported in 2020. So human trafficking, modern slavery, and trafficking in persons. These are umbrella terms. They're used interchangeably, and they refer to a crime where a perpetrator, who we often call a trafficker, exploits and profits at the expense of adults, adolescents, or children by compelling them to perform labor or engage in commercial sex acts. Now, here in the United States, we recognize two primary forms: forced labor and sex trafficking. There are other types of human trafficking that are recognized globally. There's child soldiers, where children are trained to fight. There's mail order brides. And there's also another type that's actually happening in the United States, organ harvesting, where the poor are kind of preyed upon, P-R-E-Y-E-D. They're preyed upon and they're told, hey, you only need one kidney. You don't really need that pancreas. And then they are kind of coerced into donating that organ. And then the elite, the wealthy, they do not have to wait on a transplant list. They get their organ and then life is good for them. It's happening in the United States. I have my own reasons as to why it's not legally recognized. Well, I'll just go ahead and say it. I know we are recording, but I have a feeling there's going to be a lot of well-known physicians and maybe some large hospital systems that are going to be exposed once this leaks. But currently in the United States, just forced labor and sex trafficking. Those are the two types we recognize. Human trafficking is the fastest growing industry in the world. Sad when a crime is your fastest growing industry. And it's described as a highly profitable hidden crime. Some say it's hidden in plain sight. It's happening right in front of us. We don't even know. It's happening in our neighborhoods, at our churches, in our schools, in our healthcare facilities, and we don't even recognize it. Highly profitable. I read an article that said on average, a trafficker can make about $300,000 just by recruiting one person into the lifestyle. So it is highly profitable. But the Department of State actually leads the United States efforts against human trafficking, supports all anti-trafficking, human trafficking legislation. And we do estimate that the crime affects around 25 million people globally. So think to yourself, true or false, human trafficking is always or usually a violent crime. And that's false. The most pervasive myth about human trafficking is that it involves physically forcing someone into a situation, or they're kidnapped and they're held against their will. That is not true. Many times traffickers have a psychological hold over their victims. So they trick them. They defraud them, they manipulate them, they threaten them into providing that commercial sex or that exploitative labor. Now, one thing to mention is that these victims are commodities. So a buyer who chooses, to purchase these individuals, a buyer may become violent with them. But when you look at the trafficker and the victim, that relationship, it is not violent. I don't know, I guess maybe news and media, have kind of made us think, those fake Facebook posts that say, oh, that they were locked in a basement, chained to a chair, those types of things, those are not the reality when it comes to the crime of human trafficking. So the Trafficking Victims Protection Act, the TVPA, is the national framework for the federal government's response to human trafficking, first enacted in 2000, and it has been reauthorized and updated 5 times, most recently in 2019 when Congress appropriated $250 million to fight the crime. Thankfully, it has bipartisan support. It's one of the few things that has bipartisan support, but it actually follows the 3P or the 3-pronged approach. Where the law is basically to prosecute the traffickers, protect the victims, help them as they get out of the lifestyle, and then prevention education, kind of like what we're doing here today, just to kind of inform people. There's a 4th P, kind of silent, unnoticed in terms of partnership, where different areas of society are coming together, working together to fight the crime, especially like with healthcare institutions. They are partnering with religious organizations in the town to help victims, or even nonprofit organizations. So to understand federal law, you may hear the action means purpose, or the AMP model. Human trafficking occurs when a trafficker takes an action by means of force, fraud, or coercion. And of course, the purpose is either going to be for the 2 types that we recognize here in the United States, that exploitative labor or that commercial sex exploitation. Only one element from each area has to be present to deem the crime as trafficking. So if you'll notice, the law states the actions are when a trafficker recruits, harbors, transports, provides, obtains, and then we have 3 more just for sex trafficking only: patronizes, solicits, or advertises. Only one action has to be present. You don't have to be the mastermind of the operation. If all you do is recruit, it's a crime. If all you do is drive someone to an appointment, you can be charged. That action must be accompanied with either force, so, forcing someone into a situation. We don't see that a lot with human trafficking, but it is part of the federal law. Or fraud. Fraud is when the trafficker promises something that never comes true. And then coercion, it kind of deals with the victim's state of mind. It's almost like blackmail. If you don't do this, I'm going to hurt you or your family. But that action must be accompanied by either force, fraud, or coercion. We have to see evidence of it, except when we are dealing with minors and sex trafficking. So under the age of 18, We do not need to see evidence of that force, fraud, or coercion when we were talking about commercial sex. That should make sense to you. A minor can't vote. Minors can't rent a car. So if you're caring for a minor suspicious of trafficking and they say, oh, well, I chose this lifestyle, that's incorrect according to federal law, and you obviously are mandated to report that. And then, of course, the purpose will be either for that forced labor or commercial sex. I just want to look individually at both types of human trafficking just to make sure we're all on the same page. So forced labor, it's also referred to as labor trafficking. It encompasses the range of activities involved when a trafficker uses that force, fraud, or coercion to obtain the labor or services of another person. Again, one element from each area must be present to constitute the crime as forced labor. So the actions, again, when the trafficker recruits, harbors, transports, provides, or obtains a person for labor, and of course, that action has to be accompanied. We have to see evidence of force, fraud, or coercion. Domestic servitude is a type of forced labor, I guess you could say. Some countries legally define it as a different type of human trafficking. Here in the United States, we kind of classify it under forced labor. But domestic servitude refers to someone providing services, providing labor in a private residence, in a home. And typically the owner of the home, the owner of the residence controls the victim's access to food, transportation, shelter, all that kind of stuff. And honestly, what happens in a private residence, it is hidden from the world. It's hidden from labor inspectors. It's hidden from law enforcement. Really makes it difficult to identify potential victims. Domestic foreign workers, they are particularly vulnerable to forced labor because of those language barriers, those cultural barriers. And then the term forced child labor, it refers to those labor schemes where children are compelled to work. And although some children can legally engage in certain forms of work, if you force them or you coerce them into working, that remains illegal. And then sex trafficking encompasses the range of activities involved when a trafficker uses that force, fraud, or coercion to compel another person to engage in a commercial sex act, or causes a child, and I actually need to change that to say causes a minor to engage in a commercial sex act. When we say commercial sex act, we mean that there is an exchange of money for sex. And actually, I shouldn't say that. There is an exchange of anything of value for sex. So yeah, it could be money, it could be drugs, it could be a car, it could be a place to live. And so again, we have to have one action. We have to have one element from each area has to be present to constitute a crime of sex trafficking. So the actions, again, when the trafficker recruits, harbors, transports, provides, obtains, patronizes, solicits, or advertises. You know, if you've ever seen a sting operation in terms of human trafficking, you'll notice every time there's like 30 pictures of people who've been busted, and that's because they each had a role. They each had an action. Maybe they were just a driver, and they thought, oh well, if I'm not the mastermind, I can't be convicted. But only one action has to be present, and again, that action has to be accompanied by evidence of force, fraud, or coercion. Except when we're talking about minors, when a person younger than 18 is used to perform a commercial sex act, it's a crime regardless if we have evidence of that force, fraud, or coercion. So this is from the Department of Homeland Security. I want you to just take a moment and look at the list. These are locations, or these are businesses, enterprises where human trafficking commonly occurs. And I think your takeaway, or what you notice about this list, is many legitimate businesses. Things like landscaping, construction, restaurants, nail salons, they can be a front for human trafficking. But the bottom line is human trafficking can occur anywhere. This may be difficult to digest, but some individuals are trafficked in their own homes. One thing we have to kind of distinguish is human smuggling and human trafficking. Somewhere along the way, we've been made to believe they're the same thing. That's incorrect. They're two separate entities. Human smuggling is a crime against a country or a crime against a state where individuals are moved. They are actually moved across borders. And we just mentioned that human trafficking is a crime against a person where the individual is exploited. Again, I'm going to blame news and media as to reasons why maybe we think smuggling is the same thing as trafficking, but they're not the same thing. Human trafficking does not require crossing of international or state borders. And I just mentioned some individuals can be trafficked in their own homes. Now, an important thing to note is that smuggling can potentially lead to trafficking, especially when you think of those foreign domestic workers, immigrants who are susceptible, those language, cultural barriers. Certainly smuggling can lead to trafficking, but they are two separate things. And then it's also important we differentiate trafficking, the crime, from consensual commercial sex or prostitution. You know that all commercial sex involving a minor is legally considered human trafficking. If we're talking about adults, then that commercial sex act, it has to be accompanied by either with evidence of force, fraud, or coercion. Otherwise, it's not considered trafficking. It would be considered consensual, not necessarily legal, depending on where you live in the United States, but it wouldn't be deemed human trafficking. Commercial sex involving adults is human trafficking if they are providing sex against their will as a result of that force, fraud, or coercion. So another one for you here. All commercial sex is human trafficking. You now know that that is false. Yes, it is when we're talking about a minor, but with adults, no. We have to make sure we can distinguish the human trafficking from prostitution, and that is done with evidence of that force, fraud, or coercion. So an important question to ask, who can be a trafficker? Again, according to the Department of Homeland Security, a man or a woman can be a trafficker. Parents or family members. And to go back to a man or a woman, in this presentation, I typically, when I talk about victims, I will say she. But I mean, we know that men can also be a victim of human trafficking. So just be mindful of that. It's just kind of out of habit. I think the Polaris Project says when you look at victims, it's about a 70-30 split. So most victims, it's about 70% are females, 30% are males. But I don't know why I said that, because we're actually talking about traffickers here. Sorry about that. So a man or a woman, parents or family members, this is really sad to hear, but we've witnessed parents who've sold their children for sex just so that they can get money for that next drug fix. But neighbors, boyfriends, girlfriends, peers, employers, gang members, again, the bottom line, anybody can be a trafficker. We really don't see a one profile for traffickers because they come from all walks of life. Who's vulnerable? Who's susceptible? Literature tells us people of color, and then LGBTQ plus individuals are vulnerable because of historical oppression, discrimination, and other societal factors and inequities. But one thing you have to remember is a trafficker is looking to prey, P-R-E-Y, prey on people's vulnerabilities. So if you have an unstable living situation, traffickers can provide you a place to live only if you come do this job for me. But a history of domestic violence, addictions to drugs or alcohol, maybe a relative who has a substance abuse issue, runaways, juveniles in the foster care system. Literature says that within 2 days, 48 hours of running away from home, most adolescents will be approached to participate in some type of commercial sex exploitation. We talked about the undocumented immigrants, someone who's facing poverty or economic need. A trafficker knows this, and they can provide some money. They can provide whatever that need is only if you come do this job. And then, of course, a history of sexual abuse. But again, the bottom line is anyone can be susceptible to the crime, just like, someone can be the victim of some other type of violence or some other type of crime. True or false? Traffickers only target victims they do not know. That is false. Again, we've seen parents sell their children. We've seen spouses, do the same. Um, I'm not saying it doesn't happen, because in 2020, we did see an increase in traffickers recruiting people off social media, people that they don't even know. But many times the perpetrator, the trafficker, is someone the victim knows. So it's not all the time. In terms of recruitment, I mentioned that social media played a big role in 2020. But actually, if you remove the patient element for just a moment and just think of like your family, a loved one, if there's certain things that just raise your suspicion, ask. If someone's talking about a job that just sounds too good to be true, or maybe they have to move far away and they can't tell you an address, they can't give you a physical location, ask. Maybe someone's forced to sign a contract in a language that they don't understand. That's definitely a highly suspicious scenario. Or charging fees to work, in an enterprise. Those should all raise some concerns for us, and we should ask questions. Um, I'm working with a nurse from Missouri, and um, we're working on. She's a forensic nurse, and she spends all day working with sexual assault victims in Missouri, and we are working on some grounding techniques. Um, that are modality specific, because we know our field is very diverse, and so we're excited. I'm excited about this because this has not been tapped into in our field. But if you've got a patient who's been victimized, whether it's assault or maybe trafficking, maybe they're in a state of emotional distress, there are some grounding techniques that we can do to calm them, get them back to a state where they can understand us, and we can get our exam performed. So I'm really excited about that. But this particular nurse shared with me a screenshot from a website. And it's the most disturbing thing that I have ever witnessed in my life. And I haven't been able to put it in this presentation because it's just disturbing. But she compared the crime of human trafficking to ordering a pizza online. I want Domino's tonight. I want Pizza Hut. You pick wherever you want, and then you pick your toppings. The same is true for this crime. There were places for you to check your preferred height. There were places for you to pick your preferred weight, chest size, grooming features, you name it. It was on that website. You selected it, and it could be delivered to your hotel room within an hour. Of course, the FBI shuts down these websites pretty quickly, but because of her work with sexual assault victims, she was able to find access to a few of these, but extremely, extremely disturbing. When you think about the work environment some of these individuals, some of these victims are working in, and maybe even their living situation, then there are certain physical or behavioral signs and symptoms we might anticipate them to present to a hospital for care with. Headaches, GI symptoms like dehydration or malnutrition. A lot of these victims are given a small amount of money to live on, so they might not have enough money to pay for food. They might not have enough money to buy water. A lot of them have to meet a daily quota, especially with sex trafficking victims. They have to meet a daily quota, so maybe they don't take the time to eat. Pelvic pain is a big one. More than likely, it's related to undiagnosed sexually transmitted infections. A lot of sex trafficking women will insert cotton into their vagina to hide their menstrual cycle so that they can continue working and meet that daily quota. Some may present with musculoskeletal symptoms like back pain, fractures, skin conditions. If you think their living situations, maybe there's several individuals sleeping in one bed. We see, scabies a lot. The bruises, remember that relationship with their trafficker is not violent, but the bruises are also common because the buyers may become a little aggressive with them. The crime is associated with poor mental health, pregnancy, multiple abortions. I know what you're saying. That can't be true, Kevin, because if they're pregnant, then they can't work as much. But you have to remember, a trafficker is looking to fulfill someone's unmet needs. So a baby might fulfill a need for a young lady and make her hesitant to ever ask for help, to ever run away. And then, of course, it's associated in terms of sex trafficking, it's associated with sexual dysfunction. And then there's some behavioral signs they may present with. I think the big takeaway with this is that a lot of them do not realize that they are being exploited. That coercion is really strong, and that psychological control is really strong. So they've been made to believe they deserve this. Oh, I just made bad choices in life, and so these are the consequences of my bad choices. So they may be self-blaming themselves for what has happened to them, feeling frightened, depressed, or anxious. They may tell you that they don't sleep well at night, they have disturbing nightmares, inconsistencies with their job or their lifestyle. But the American Hospital Association, the AHAA, gives us 10 red flags that say, hey, the patient you are caring for might potentially be a victim of human trafficking. And I would be remiss if I didn't go through all 10 of these. Some of these are very self-explanatory, but we'll just quickly fly through them. The first one, the clinical presentation and the oral history doesn't match up. We see that all the time with child abuse. Those of you in imaging, we see it all the time. The history that's given by the caregiver doesn't match up with the injury. Things just aren't adding up. The second one, the oral history appears memorized. And that's probably true because more than likely they've been coached what to say. So when you start asking secondary probing questions, they can't answer you because they don't know what to say. They hadn't been coached. Red flag number 3 is a really big, important piece of the puzzle. Someone with the patient exerts an unusual amount of control over the visit. They do all the talking, they're answering all the questions, they fill out all the paperwork, they possess all of the documents. And if you think about it, especially when we think of minors, the biggest milestone for an adolescent is getting that driver's license. So what 16-year-old, what 17-year-old wouldn't have their driver's license on them? It's such a milestone, but more than likely the trafficker possesses all of the documents. Number 4, those behavioral signs we briefly went over earlier: fearful, anxious, depressed. Number 5, the patient is concerned about being arrested or going to jail. If it goes to court, for it to be deemed trafficking, there has to be evidence of, that force, fraud, or coercion. So if you're caring for a patient and you hear them say something like, oh, I'm worried I may go to jail or something, might consider documenting that in the electronic health record. Or even number 6, the patient is concerned for their family's safety. There's that coercion right there. So documentation is real important, but it's an iffy situation as well when you consider everything is electronic. Number 7, evidence that care has been lacking for prior or existing conditions. You might see some unsanitary fixes. I don't know if that's the best word. But I read an article that talked about the debt burden that many of these victims face. If they have to stop working, whether it's forced labor or sex trafficking, if they have to stop working to go to a hospital for care, then many times the cost of that care is added to their debt burden. So in terms of forced labor, the employer may say, hey, you're going to have to work double time, and I'm not paying you. I'm not paying you because you missed out to go to the hospital. Or for sex trafficking, they may say, hey, instead of 6 clients today, you need to get 12 of them done. And so with that debt burden, sometimes they're not going to come back for follow-up care. So if the wrist is fractured, a cast is put on, more than likely they're not going to come back for follow-up x-rays. They're not going to come back to have the cast removed. The trafficker is just going to remove it themselves. And so that's kind of what I mean by unsanitary fixes. 8, another big piece of the puzzle, tattoos of ownership or branding. We are even seeing barcodes tattooed on people, letting them know that they're owned by a pimp. But many times these tattoos are homemade, real poor quality. Sometimes they're numbers, they could be a name. There's literature just now starting to come out that different symbols represent something. And I'm not going to touch on that because the literature, I only want to share with you things that is in published literature. But like a crown, if you see a crown tattoo, that signifies ownership in terms of trafficking. But we're just now seeing literature come out on that. But tattoos are a point of conversation, especially if you have a minor, because parental consent is needed for a tattoo. So you could say something like, how did you talk your mom into letting you get that tattoo? And if she can't answer or he can't answer, there might be a reason. With forced labor, you see those occupational type injuries where they were injured on the job, but no safety training, no training in ergonomics. And then number 10, sexually transmitted infections with sex trafficking victims, and they're usually repetitive. Always consider the mindset of your patients, especially if you're suspicious of trafficking. I just want to probably just look at a couple of these bullets. The second one here, disoriented. I mentioned earlier that they don't have to be moved around, and that is 100% true. But if there is a large event taking place, the World Series, the Super Bowl, then more than likely traffickers are going to load up their workers and go to these locations to make some money. If people can spend a lot of money on a baseball game, a football ticket, then maybe they'll want to spend a lot of money when they go back to their hotel and have a crazy night. So they might not know, they may be disoriented. They might not know what city they're currently in. We've already said that they think that they've broken the law. They don't really know that they're being exploited. And we're all familiar with the Stockholm Syndrome, where victims of abuse bond with their abuser. We see the same thing with human traffickers and their victims, but we don't refer to it as Stockholm Syndrome. We now call it trauma coerced bonding. We've all seen this story on social media. White passenger vans or commercial vans are a sign of human trafficking. That is false. There is no literature to suggest that. And in fact, not to be insensitive here, but if a trafficker is making $300,000 by every recruit that they are bringing into this industry, they're probably going to have a nice ride. But yeah, no literature to support this. So how should you respond if you believe the patient you are caring for is a victim of human trafficking? And this is the most important thing I'll tell you all night. Your job is not to rescue them. I know it goes against every fiber in our being as patient care frontline staff workers. That's not our job. Our job is to simply tell them help is available. There is a way out of this lifestyle. You're not to blame for this, but if you need help, there is help readily available. And if they hear that every time they present for care, then eventually they may say, okay, I'm ready, I need help. I shared this presentation at the New York State Society this past weekend, and one of the students cornered me afterwards and said that they work in retail, and they're taught that in retail. If you see a shoplifter, don't confront them. let them take whatever it is, and hopefully the cameras catch them. So he was like, I wasn't real surprised when you said that, our job isn't to rescue them. It's not like we're calling the police, hey, come to the back door at this clinic. We've got a victim we need to rescue. That's not what we're trying to do here. If you are able to separate the trafficker from the victim, and many times we can do that because we can say, oh, you're not allowed in the exam room. So if you are able to separate them before you ask any sensitive question, you better check their cell phones. You better check to see if they're wired up. Traffickers are very tech savvy, and they know when they go to a hospital, they may be separated. And that's when they use those tech skills. Check cell phones. Sometimes they're monitoring the GPS of the cell phone. Sometimes they're listening in. So before you say anything, because you definitely don't want to jeopardize yourself or your colleagues, make sure you check those cell phones. And a lot of times in our facilities, hey, all of your personal belongings, we need to stick them in a locker. And so that can kind of help you with that. Limit staff involvement. It could be that maybe your front desk people they're not the best actor, they're not the best actress. And so if they know the physician is suspicious of trafficking, what's going to happen when the trafficker comes up to the window, knocks, hey, how much longer? And the receptionist just freezes, can't even talk. The flip side of that is, remember, it's going to be the receptionist, the front desk people who see, this person had all the documents. They filled out all the paperwork. So you just kind of have to figure out what works best for your institution. Preserving that autonomy, that's, again, we're not there to rescue them. That is their choice. And only until they say, hey, I need help, then you're going to provide them with the resources, which I'll show you here shortly. But make sure that we are respecting their autonomy. Use a professional interpreter. Never use whoever is accompanying the individual, because you have no idea if they are interpreting correctly. You think, oh, they're telling them what I just said, but in fact, they could be saying, don't say a word, don't move, all of this. The good thing with imaging, and maybe even with therapy, I don't have a strong background in therapy, although I do work at MD Anderson. The good thing with imaging is we can say, hey, we couldn't see what we needed to, so we need to reschedule, make another appointment. And then if we were allowed to do that, then maybe at that point we can schedule an interpreter to come in, and that way we can separate them. But definitely don't use anyone accompany the individual, the patient, to interpret. And then apply trauma-informed practices. Next month, I'll share more with y'all. But trauma-informed care just means that we have to be sensitive to the patient's needs. And y'all, these can be small things that we do and like we routinely do that could trigger someone, not just a human trafficking victim, but anybody who's dealing with some type of trauma. I think of like a rape survivor in the ER. And let's say the ER ordered some type of imaging study. Typically, we just go bouncing in there. Hey, I'm Kevin from ultrasound. I'm going to take you down to the department and do this exam. And we just totally invaded her safe place. So with trauma-informed care, we're gonna be sensitive. We're gonna knock on the door. We're gonna peek our head in, and we're gonna ask, can I come in? And if they say no, always with trauma-informed care, honor the no, respect the no, don't go in. You could say, hey, can I check back in 5 minutes? If they say yes, set a timer on your phone, be back there in that 5 minutes. When you go back, maybe they'll let you in then, maybe it's a no. That's when you go to the nurse. They make the big bucks to help you, and they can kind of intervene to get the exam done. But I'm really passionate about trauma-informed care, and so I'm excited to share that. I'm not going to go into much more detail because I'll share more with that. But one thing I do want to say is lots of literature out there that tells us if we focus on the patient's senses, then we can get them back to a state of calm, relaxing, where they're coherent, they can understand our instructions, they're not in distress. Um, it could be something as simple as turning on the television, and telling them, every time you think about your victimization, whatever that brought them in, every time you think about that, look up at the television, put something funny on, like Ellen, or something that's going to make them laugh. Don't have like Dateline on, because every Dateline story is the same plot. Maybe the smell of the perpetrator is all they can smell. Pull out that air freshener, spray it. There's lots of things we can do that focuses on their senses. And I mentioned earlier, those grounding techniques, a lot of those focus on the senses to kind of get them back to a state of understanding and calm. All I'm going to say about documentation is just be careful. And that's because everything's electronic. We now have codes, ICD codes for trafficking, both confirmed and suspected. Just be careful using those, because what happens if the after visit summary is mailed home, the trafficker opens it and sees a diagnosis of suspected human trafficking? Are they ever going to come back to your facility? Probably not. The patient portals, do you really know who's logging in, accessing that stuff? But you can always work with your IT department and say, there can be certain areas that you document, certain areas that don't get transferred over to the patient side. But just be careful with documentation. But it's also very important when you think of needing to, especially if it goes to court, needing evidence of that force, fraud, or coercion. In terms of making policies and at a facility for human trafficking, I'll just mention this toolkit here from HEAL, HEAL. I don't know what it stands for, but if you go to Google and you search HEAL Protocol Toolkit, they'll want you, the first few links will want you to buy it, but if you keep scrolling down, you'll find the PDF. Anything you can think of in terms of policies, it is mentioned in this toolkit. So if you're at a facility where you're assigned to develop protocols, procedures, policies related to human trafficking, definitely you want to pull up this toolkit. One of the things the toolkit says is, do you really want to call law enforcement when you identify a potential victim of trafficking? And the reason is, many of these victims have some past offenses. And it could be related to their victimization, or it could be unrelated. And I listed some that the literature tells us some of their past offenses. But some state or local laws that, I mean, if they show, if your policy says, hey, call in the cops show up, they do a quick interview, and then they realize, there's an open warrant out for this patient's arrest. And if they are arrested under your care, because some state or local laws will require them to, if there's an open warrant, they'll have to be arrested right then and there. Arrested under your care, you're probably never going to see them again. And so here in the United States, there are different, every state does things differently, of course, but some states are doing a little bit better job than others, where they are working to kind of wipe away some of those past offenses, and more so all of the offenses related to their victimization, wiping it off their record. They call it criminal record relief. Because if you think about it, if someone is able to get out of the lifestyle, they've survived, they're out, and now they go for a job interview, background check shows all of these past offenses. Because even an arrest without a conviction, they're going to show up on these background checks. It's, sorry, no job for you. They go to try and rent an apartment. They're trying to rebuild their life. They go to rent an apartment, background check, no, can't do it. What do you think is going to happen? They're going to go right back to their trafficker. They're going to go back to that. And so that cycle of exploitation starts all over again. But if you'll notice, in California, y'all really do a pretty good job. I know you see a D at the top and you're like, oh, but you're ranked 6th out of the 50 states in terms of you working with victims, and helping them rebuild their lives. One of the things that sets y'all apart is this confidentiality. If someone goes through this record relief, then it is kept confidential in the court system. It's not disclosed. It's not published in a newspaper or something. Other states will disclose that. So y'all, yeah, you have a little bit of work to do, but this is why it's so important we hold our state legislators' feet to the fire and get them to really to help these victims so that they can rebuild their lives and kind of start over. But I'll tell you, in Texas, we're ranked, I think, 36 out of 50 states, and we actually have an F. So we definitely need some help over here. But just real quick about that toolkit, I told you anything you can think about is in that toolkit. And one of the things, this third bullet, strategies for interviewing the patient alone. If you can't seem to separate the trafficker and the patient, this toolkit tells you, go into the room, look at the trafficker and say, hey, the doctor needs to speak with you right now. You can separate them. Or, hey, I need you to come with me to the nurse's station. You got to make a phone call. You need to schedule, we need to reschedule something. There's all kinds of ideas to help you separate, and that way you can have that alone time with the patient. But I can't say enough good things about that toolkit. And then you probably see these in restaurants, in the bathrooms, where you pull off a tab, you hand it to a waiter. The one on the right says to go up to the bar and ask for Angela, and that lets the bartender know this individual is in distress. We have these in the Texas Medical Center. One thing, like the one on the left, we don't say sex trafficking. We don't say human trafficking because most of these victims don't know what that means. We say, are you being forced to have sex with multiple people against your will? We have questions like that. And then if they read that while they're in the bathroom and they're like, oh, that's me, then they can pull a tab and hand it to somebody. But again, it's sad that we have to do this, but we are trying to be an advocate for our patients. I think this is my last true or false. Traffickers use recorded sounds of babies crying to get women into unsafe areas. That sounds like some urban legend to me, but that's absolutely false. Remember, most traffickers, their victims they know personally, so that's why they've been targeted. They rarely target people they don't know, but it does happen. So the patient tells you, hey, I need help, I'm ready for help. What do? This is the first thing you give them. You give them the information to the National Human Trafficking Hotline. There's their website, their toll-free number, 888-373-7888. Or you can tell them, hey, when you get home, you can text the word help or info to 233-733. And 233-733 stands for be free. Maybe something that they can remember when they get home, because you don't want to give any cards. You don't want to give any flyers. You don't want to leave a paper trail and risk the trafficker finding it. But someone is available 24 hours a day, 7 days a week to respond to either a call or to a text message. And one of the other biggest things you can do, if a patient says they need help, refer them to a social worker. Every time I give this talk, I encounter an RT who comes up to me afterwards and they'll say, it's not in our scope of practice. We can't make referrals. You are incorrect. As an RT, I can refer a patient to a social worker. If there's any radiation therapist on the call or radiation therapy students, radiation therapists refer patients to social workers all the time. They see their patients every day, 7, 8 weeks, in a row. Patients sometimes see their radiation therapist more than they see their doctor, their oncologist, their primary doctor. So many times that familiar face, they'll disclose some things. They'll open up to their therapist. And so radiation therapists, there's literature that says they refer to social workers all the time. Our field is medical imaging and radiation therapy. So why would radiation therapists be able to make referrals, but imaging technologists can't? That's not how it works. But if you do refer to a social worker, make sure it's verbal. While they're in under your care, maybe you can pull it up on the computer. Hey, this is how you get to their website. This is how you get to this social worker's office. They will help you. I tell people all the time, there's like God and Jesus, and then there's social workers. They are some amazing people. They really do. Of course, you have to, you're mandated to report that sex trafficking with a minor. I don't know California law. I will tell y'all this, when I was trying to look it up, y'all state website has a lot of broken links. And that's not good. But it looks like y'all report to your county. Like here in Texas, we report to the state, and we can either make a referral online, or if we think that the minor or even the elderly person, if we think they are in distress, or something may happen, then we are encouraged to call. But just FYI, y'all have some bad links on your websites in terms of getting to some of this contact information. Definitely establish some relationships with religious organizations in your town. You can show them on the computer, hey, this church located right here, they will help you. They can get you into a hotel tonight. They can do this, blah, blah, blah. And then I noticed this Commission on Peace Officer Standards and Training. This was one of the things that caused y'all to have um, a high ranking in terms of record relief, is because of the training that y'all are doing in the state. And then another one I found was the SOAP project. SOAP stands for Save Our Adolescents from Prostitution. And what they actually do is you reach out to them and they'll send you bars of soap that actually have the human trafficking hotline number on it, a place that a trafficker may not think about looking until, we put this talk out, and then they're like, oh, I better check the bar of soap. So if we go back to our scenario, hopefully now you're a little bit more aware that requisition came through and you saw pelvic pain, abnormal bleeding, the low-grade fever. Those could definitely be signs of sexually transmitted infection. They could be abortion-related complications. You entered the room, you saw the dominant, overpowering boyfriend. Right then and there, if you had a policy at your hospital that said, sorry, you're not allowed in the room with us, and we have professional interpreters on staff, that could have squashed that issue right there. Her demeanor kind of showed those behavioral signs, seemed real quiet, reserved, frightened, depressed. The tattoo is a point of conversation. Had you been alone with the patient, you could have asked her, what does this tattoo 713 mean? The cotton debris, that's a big one. I shared this scenario with all 500 sonographers at MD Anderson, and every one of them were like, I knew that had something to do, but I had no idea, the reason why. I shared this talk with a sonography department in Florida a few weeks ago. They just wanted the scenario. The director just wanted me to present the scenario and then work with the sonographers going through each of the different aspects. And again, they were like, I assumed the cotton debris meant something, but had no idea. One lady actually said, oh my gosh, I saw this last week. And something in my gut told me something was wrong with the situation, but she said I wasn't educated. I had no idea. So the tattoo, we saw that. So hopefully now you've just got a little bit better understanding some of the red flags, and then hopefully you know how to respond if you ever encounter caring for a patient or a victim of human trafficking. So remember, we recognize two types: forced labor, sex trafficking. We need to see evidence of that force, fraud, or coercion, except when we're talking with minors and sex trafficking. You can go to the American Hospital Association website. You can print that flyer of those 10 red flags, post it in your department. Those are real important. Next month, I'll get to share a little bit more about trauma-informed approach. So I'm thankful for that opportunity. It's one of those things that, at the beginning of this pandemic, people were like, oh, my hospital's not providing me a PPE. They say we're not essential staff. And if we want to be recognized on the same level as physicians and nurses, one of the things we're going to have to do is step up our patient care. And I heard someone say recently that because of the pandemic, they're short-staffed, and so they don't have the time. They can't take the time to care for. It's just get them in for the exam, get them out. We will still be dealing with, maybe being characterized as non-essential until we step up our patient care. So I'm really excited to share about that trauma-informed approach, because that does amp up our patient care that we provide. If you have to develop protocols in the future, you become a director, don't forget that HEAL protocol toolkit. It's great. I'm sure it'll be updated. I think it was published in 2017. And we want to be an advocate for all of our patients, especially our human trafficking victims, because we have a pretty important role to break that cycle of exploitation. References that no one's really interested in, and then I'll just end on this, but you can certainly go to their website and print some flyers and stuff that you can hang up around your department. I appreciate your attention. If I can answer any questions, I'm more than happy to. But thanks so much.
Thank you so much, Kevin. That was super insightful. I think it's a topic of really high importance in our field. And I learned a lot too.
Perfect.
Coming out as a student, heading into the field, it's great to have you're ahead of the curve here as we try to start really seeing a lot of patient load.
For sure.
Does anybody have a question for Kevin at this point? I might just say I just recently had another student friend say that she was in a situation where she had suspected some sort of child abuse. I know that's a little bit different from the trafficking,
Right.
but it's probably similar, where there's accessible protocols in place and things on babies. She was taking care of a baby, doing something in the hospital. But yeah, I mean, same thing with the minors. If you do suspect the minor, and they're obviously either with the parent. Can you talk a little bit about that?
Yeah, we in the Texas Medical Center, we actually have signs in all of our hospitals that say patients 12 years and older will be allotted time alone with their provider. So many times that kind of, especially if you have someone who challenges that separation policy, they're like, no, I need to be here. We just refer them, hey, anyone 12 years and older is allotted time along with their provider. But I do know several hospitals, they kind of just modified their child abuse protocols for pediatrics and whatnot in terms of trafficking. So it can be something as simple as going to your child abuse protocols and just adding human trafficking, in there as well. But yeah, it's that when someone accompanies the individual, that can be difficult. That can be really difficult. But if you've got policies in place, you've got signage everywhere, and that's one of the things with trauma-informed care is you've got to get along with them, because they're not going to disclose anything, with someone standing next to them. You got to get them alone. And one of the things we can do is we can thank them for coming in for care. And that's a big thing with trauma-informed care is we no longer ask a patient what's wrong with you. Instead, we say, what has happened to you? And then once they disclose it, we say, you're brave for coming in. Thank you for coming in. You're safe with me. I can help you. And so those it's going to elevate our care that we provide. And I don't even know if I answered your question. Tell me yes or no, and I'll try it again.
No, I think so. Yeah, I think, and I don't know if Child Protective Services comes into play with the abuse situations. So I know there's that whole separate route.
And in Texas, we are, and I don't know California law, but we are mandated, not just minors and elderly, but also handicapped individuals with physical disabilities. And that can be really challenging when they are being sex trafficked. And that could be a presentation all on its own in terms of what are some best practices when dealing with someone who's physically impaired being trafficked. But we are mandated to report all of that as well.
All right. Thank you so much.
You bet.
Any other questions anybody else has? No. Okay, great. Oh. Well, thank you so much for your time. I appreciate it. I know
Yeah,
you're a couple hours ahead of us, so.
it's bedtime.
Thank you, Dr. Clark. See
You-
you next month.
You bet. You bet. Thank y'all for this
Thank
opportunity.
you so much.
Thank you.
Thank you for coming in.